Hi guys, welcome to our anatomy lectures. Alright, so today we are going to talk about the mediastinum, right? So, mediastinum is a very complex compartment that is filled with structures which lies within your thorax. So, if you remember very well, we said your thorax is conical in shape. It's going to have a superior aperture that is going to be bounded posteriorly by the T1 vertebrae, anteriorly by the upper border of your manubrium, and then laterally by the medial borders of your first rib, and then your inferior aperture, which is greater than the superior aperture, is going to be bounded by the diaphragm. You see this dome of the diaphragm, right? We said it is convex within the thorax and concave within the abdomen, right? So this diaphragm marks the inferior aperture, closes the inferior aperture. So at the side, inside your thoracic hole, you're going to have your your pleural cavity that is going to have your lungs. Remember, and remember that your lungs they extend towards the root of the neck, right? Their apex extend towards the root of the neck, right? So you're going to have lungs and lungs, right? And then posteriorly, you're going to have the vertebra, thoracic vertebra, T1 to T12, right? T1 to T12, that will be posterior. Then anteriorly, you're going to have the manubrium and the sternum, right? So the area that is between the posterior thoracic vertebrae, right? The anterior sternum and the mediastinal pleura, right? Of your lungs is going to be called the mediastinum. The mediastinum. So the mediastinum is going to be divided into two. That is very important. You're going to have what called superior mediastinum, right? So this is your superior mediastinum. You can see the superior mediastinum, and then you're going to have your inferior mediastinum. Your superior mediastinum and inferior mediastinum, they are going to be separated by an imaginary plane that is on the level of the sternal ankle. So if I draw a line here, right, on the level of the sternal ankle, I'm going to form a plane that is going to divide your superior mediastinum from inferior mediastinum. So this plane anteriorly, it will be having the manubrosternal joint. Remember, the manubrosternal joint is a secondary cartilaginous joint that forms the sternal ankle, and posteriorly is going to be at the lower border of the T4 vertebrae. You can see. So it's very important to understand what is transected by this plane as it divides the superior mediastinum to the inferior mediastinum, from the inferior mediastinum. So anteriorly is going to mark the manubrium, the manubrosternal joint, which is the joint between the manubra and the sternal body, and then it's also going to mark the second costal sternal joint, right, of the second rib. Is it right? And then it's going to mark also the bifurcation of your trachea. So the trachea, it bifurcates at the level of the sternal ankle. It will also mark the uh, the demarcation of the ascending aorta to the arc of the aorta, right? And then also demarcates the separation of or the continuation of the arc of the aorta to the descending aorta. Is it right? So that is important. That is very important. You have to take note of that one. So what is important is to know the boundaries of the superior mediastinum and the boundary of the inferior mediastinum. Right. So your superior mediastinum, as you can see that anteriorly it's going to be bounded by the what's this? That's the manubrium, right? And then posteriorly is going to be bounded by the upper four thoracic thoracic vertebrae, T1 to T4, right? And then superiorly, you're going to have the superior aperture, right? We have spoke of the boundary of the superior aperture. And then inferiorly, you're going to have that imaginary line, right? That is along the sternal ankle, is it? So those are going to be your boundaries. So inferiorly, the imaginary line, superiorly, the superior aperture, posteriorly, the first four thoracic vertebra, and then anteriorly, the manubrium. And then laterally, you're going to have the mediastinal pleura of the lungs. The mediastinal pleura of the lungs, right? So you can clearly appreciate here. So if I draw a line just right here, right? If I draw a line, this part is not, the line is not demarcated. If I draw a line right here, let's say right here, so that line is going to separate. So above the line, that's where you're going to have the superior mediastinum, and then below the line you're going to have the inferior mediastinum. So you can clearly see that your lateral boundaries of the mediastinum is your mediastinum pleura. So this is your mediastinum pleura. This is another mediastinal pleura, right? And then superiorly, you can see that you have your superior aperture right here, right? So what is going to be contained within the superior mediastinum? Very important. So from the superior mediastinum, right, we want to move. If we take a line and then we intersect like this, right, you can see from this ankle, there are structures that are within your superior mediastinum that are very important. So you can use a mnemonic called T-vate, 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 T-V-A-T-E, right? So obvious, the most anterior you're going to have your manubrium, right? Because it forms the anterior border of the superior mediastinum. And then you're going to have your retrosternal space. So the retrosternal space, you're going to have fat as well as the thymus, the remains of the thymus, right? So you're going to have the remains of the thymus right here, is it? And then you're going to have the veins, the great veins, right? So if you remember very well, you're going to form the superior vena cava, and the superior vena cava is formed at the right margin of the manubrium by the joining of the right and left brachiocephalic veins. So the right and left brachiocephalic veins, they are going to be formed by the left jugular vein, the left internal jugular vein, and the subclavian vein. They join, they form the right and left brachiocephalic vein. But what you have to take note of this is that the left brachiocephalic vein, it will move from the left and then it will cross anterior to the branches of the aorta, the arc of the aorta, right? And then it joins at the right margin of the manubrium with the right brachiocephalic vein, and then they form the superior vena cava. You can see the superior vena cava. So remember this, that the left, it crosses, right, anterior going to the right, because your superior vena cava is formed to the right because it will drain to the right, what? Drain into the right atrium, is it? So structures that are found, so we are saying anteriorly, from anterior to posterior, we have the thymus, right? And then from the thymus, you're going to have the great veins. So T-vate, so T-V, V, great veins, right? So your great veins, that can be most likely that will be left brachiocephalic vein, that will be crossing towards the right to join the right brachiocephalic vein to form the superior cava, is it? And then from that, you're going to have your great arteries. You can see, and your great arteries, these are the branches of your aorta, of the arc of the aorta. This is the arc of the aorta, and these are the branches of the arc of the aorta. You're going to have the right brachiocephalic trunk, Is it the right brachiocephalic trunk that is going to further divide into the right subclavian and right common carotid artery? You're going to have the left common carotid artery and the left subclavian artery. So they will all be within as a part of the content of the superior mediastinum. You also have the arc of the aorta itself. So remember the arc of the aorta, it moves upwards and towards to the left. So what is going to happen, moving from the heart, you're going to have this portion that will be covered within the pericardium. That will be your superior, that will be your ascending aorta. So at the level of at the level of the sternal ankle, right? At the level of the sternal ankle, you're going to have the arc of the aorta. So the ascending aorta is going to continue to be the arc of the aorta at the level of the sternal ankle, is it? And then the arc of the aorta, it will give its branches, which are also contents of the superior mediastinum, and then it goes down, it goes backward and to the left. You can see backward and to the left. And then at the level of the sternal ankle, it is the arc of the aorta is going to continue as the descending aorta. As the descending aorta. It's going to continue as the descending aorta. Right. So you're going to have a descending aorta. So you can see this is your descending aorta right here. This is a descending aorta right here. Right. So the arc, so the question can come, true or false, the arc of the aorta is completely in the mediastinum, superior mediastinum. What do you think? That is true, right? Because it commences as a continuation of the ascending aorta at the level of the sternal ankle, and then it ends at the level of the sternal ankle as it continues as the descending aorta or the thoracic aorta. Right. So if we remove if you remove the large veins, the large arteries, right, you're gonna meet the what? The trachea. So this is your trachea, right? This is your trachea. Right? So you can clearly appreciate. So you have your vein, your large artery, your trachea, right? We are moving from anterior to posterior. And then your trachea is going to bifurcate at the level of the sternal ankle as well. That's where it's going to bifurcate into two principal left and right bronchi. Is it? And then you're going to have this one after the trachea. You're going to have the esophagus. The esophagus. So the esophagus is posterior to the trachea. That is true, right? And then from the esophagus, you're going to have the thoracic duct as well as the sympathetic chain. The sympathetic chain. So let's do it once again. So from anterior to posterior, you have the manubrium, the thymus, the remains of the thymus. Remember, it convolute as puberty. And you're going to have the great vein, and we said the left brachiocephalic vein to cross the mediastinum, going to join with the right brachiocephalic vein, forming the superior vena cava. And then you're going to have your arc of the aorta that commences and terminates inside your superior mediastinum, and all its branches are within the superior mediastinum. And then from the arc of the aorta, you're going to have your trachea. That we said it bifurcates at the level of T4 vertebrae. And then you're going to have your esophagus. You can see this is your esophagus, right? And then from the esophagus, you're going to have your thoracic duct as well as your sympathetic chain. Take note of this. there's a groove that is between, that is formed by a nerve that will be between your trachea and your esophagus. So that groove is for the left recurrent laryngeal nerve. Your left recurrent laryngeal nerve, right? It's very important. So you cannot see it here, but you can appreciate it that between the trachea and the esophagus, you're going to have the left recurrent laryngeal nerve, right? So this is a cross section at the sternal ankle. Oh no, this is not at the sternal ankle because we can see. So this is now your inferior mediastinum that we are going to talk about very soon, right? So that is what is important when it comes to the superior mediastinum. Know the contents, know the borders, and then you'll be good to go. Now let us go to the inferior mediastinum. The inferior mediastinum. Right, from here you can clearly appreciate all the demarcations of the mediastinum. This portion is your superior mediastinum, right? And then below this sternal ankle, you're going to have your inferior mediastinum. Your inferior mediastinum is going to be divided into three, right? And it is the heart, or the heart which is within the which is within the inferior mediastinum that will divide what? The mediastinum. So you have to take note of this. The heart is found in the mediastinum, right here. Its pericardium is going to be within this position, right? And then the region of the mediastinum that is posterior to the heart is called posterior mediastinum. And the region that is anterior to the heart, this region, is called the anterior mediastinum, right? So let's start with the boundaries of the inferior mediastinum. So anterior boundary, you're going to have the body of the sternum. You can appreciate it, right? The body of the sternum, right? And then posteriorly, you're going to have the lower the lower 8 thoracic vertebrae. We are starting from T5, and then we are all extending to T12, right? So from T5 to all the way to T12, that will be your posterior wall. And then laterally is the same. You're going to have the mediastinum pleura. You can see the mediastinal pleura that is formed by what? By your lungs, right? The mediastinal pleura to form the lateral, right? So anterior, you can clearly see that is your body of the sternum. Posterior, you're going to have the lower 8 thoracic vertebrae, that is T5 to T12, right? And then we say the mediastinum is divided into three. The mediastinum is gonna contain your heart. This is your bluish. You see, it's gonna contain your heart. So your heart will be surrounded by a fibrous pericardium. So that is what we can see outside. And then anterior to it, you're going to have your this portion that is your anterior mediastinum, middle mediastinum, your posterior mediastinum. Are we together? Right. So let's start with the anterior mediastinum. So what do you think are the boundaries of the anterior mediastinum? Right. So superiorly, the anterior mediastinum is going to be made by the plane, that plane at the sternal ankle, right? The imaginary plane between the sternal ankle and the lower border of the what? Of T4, right? Inferiorly is going to be bounded by your superior surface of your diaphragm. You can appreciate here, right? So this will be superiorly, inferiorly. Then anteriorly, you're going to have the body of the sternum, right? And then posteriorly, you can appreciate that will be what? Pericardium. Your pericardium. So this is your anterior mediastinum. So my anterior mediastinum at before puberty, you may have the thymus, right? A portion of the thymus that will be extending from the superior mediastinum getting into the inferior anterior, right? You can also have some ligaments that are called sternopericardial ligaments that will connect from the pericardium to the sternum, that are called sternopericardial ligaments, from the pericardium to the sternum, right? They are found within your anterior mediastinum. You can also remember, if you remember very well uh, from our thoracic arteries, would say that we have what called internal intercostal artery that will be running behind the costal cartilages of the upper six ribs, right? And you have to understand that one of the branches of the internal thoracic artery were the mediastinal branches. So the mediastinal branches, as they will go to supply the viscera of the mediastinum, they also pass through this anterior mediastinum. So they are also a content of the anterior mediastinum, right? So that's everything. So you can clearly appreciate it. This is your internal thoracic artery, internal thoracic vein, internal thoracic artery, internal thoracic vein, and then descending branches in the mediastinum that are called branches, and they will cross your anterior mediastinum. Right, let's go to the mediastinum. This is your mediastinum, right? So your mediastinum, you can find the pericardium of the heart, which is the fibrous uh, uh, tissue that will be surrounding your heart, and then you're going to have the heart itself, right? You're also going to have the great vessels of the heart, right? The great vessels of the heart, right here. So you're going to have the pulmonary trunk as well as the left and right pulmonary artery. You're going to have the ascending aorta. Notice the arc of the aorta, the ascending aorta. You're going to have, okay, another thing, the upper half of the superior vena cava is found in the superior mediastinum. The lower half of the superior vena cava is found in the inferior mediastinum, which is the mediastinum. So you have the lower half of the superior vena cava, ascending aorta, the pulmonary trunk, as well as the left and right pulmonary artery. You're going to have the right and left phrenic, right, right and left phrenic arteries. You can appreciate, right? So right and left phrenic nerves, right? That will be within your pericardium. So you can see these ones, these ones. These are your phrenic nerves that are here. Your phrenic nerve and your 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 pericardiophrenic artery, which is a branch of your internal thoracic artery. That will be within the fibrous pericardium, right? So that will be your content. And we also have what's called the ligamentum arteriosum, right? And also cardiac plexus as well, that will also be the mediastinum, right? That is very important. Right. Let us go to the posterior mediastinum. What do you think are the boundaries of the posterior mediastinum? Okay, let's go with the boundaries of the posterior mediastinum. So you're going to have the anterior, you're going to have your pericardium, fibrous pericardium, right? Superiorly, you're going to have that imaginary line that cross the sternal angle and the lower border of the T4. Then posteriorly, inferiorly you can appreciate your diaphragm right here, right? This is your diaphragm, right? And then posteriorly, we said you're going to have a lower 8 thoracic vertebrae from T4 to T8, right? So this is your posterior mediastinum. So your posterior mediastinum, what are you going to have? You can use the mnemonic called DETS, right? DETS. So DETS, you're going to have the descending aorta, the descending aorta, right? The descending aorta, so that's the mnemonic. It's not in order, but you just have to take note of them. that you have the descending aorta, the ascending, the descending aorta, the azygous and the hemazygous veins. The T stands for the thoracic duct. The E stands for the esophagus. The A stands for the sympathetic trunk, right? The sympathetic trunk. So that's the mnemonic. That's the mnemonic. That's the mnemonic. So you can appreciate that uh, this is your esophagus, right? This is your esophagus. Um, and this is your descending. This is your descending aorta. You can see, right? This will be your azygous vein. You can see, right? Depending on where it was cut, this is your sympathetic trunk, right? You can see them, right? The sympathetic trunk, right? So the mnemonic is DATS. DATS. The descending aorta, the azygous vein, the thoracic duct, right? The thoracic duct, the esophagus, and the sympathetic chain. Good. So you'll be done with the posterior mediastinum. Right. Let's go to clinical. So there's what you call mediastinal shift. Mediastinal shift. Right. So let's say that you have got into an accident, right? And there was great pressure on your thoracic wall, and you have a fracture of your one of your rib, and one of the rib it pierces the parietal pleura and gets into the parietal cavity, leaving an opening. So air is going to move from the outside and gets into your pericardial cavity. That is what you call pneumothorax. So when pneumothorax, the lung that is at that side is going to be compressed, right? And there's going to be an echo, right? That the patient will not be normally, right? On one side will be moving and the other side will be stagnant. So what happens is this: once there is pneumothorax, right, it means there is high pressure at this side and low pressure at this side. So there's going to be a medial shift, or structures of the mediastinum, they are going to move towards the opposite side, right? So if there is a pneumothorax at this side, you're going to have the structures of the mediastinum are shifting towards this side and compressing the 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 other lung, opposite lung. So that is what you call mediastinal shift. It happens when there is pneumothorax, right? And then secondly, you can have what you call um, mediastinum syndrome. Mediastinal syndrome, right? So mediastinal syndrome, it occurs when one of the structures of the mediastinum uh, enlarges, right? So remember, it is a limited space, right? Very limited space. So if one of the structure enlarges, it is going to compress other structures, right? So the compression, let's say that if the aneurysm of the aorta. So when there is aneurysm of the aorta is going to dilate, and when it dilates, it's going to compress all these structures, right? So these structures, they can compress even the left laryngeal, right? The left laryngeal nerve and affect your left vocal cords, and this will affect your phonation, right? Because the left laryngeal nerve is for the phonation, right? Production of sound, is it? So because of the great pressure that will be the mediastinum, you can compress your nerves, especially the left laryngeal nerve, since we said it forms a groove between the trachea and the esophagus. And then you can also compress the trachea. That will lead to what? Dyspnea, right? that is difficult in breathing. You can also compress your esophagus, that will lead to dysphagia, right? That you can compress even your superior vena cava, right? And that will lead to congestion of blood within the what the neck and the head, right? And then you can also have compression of even of the aorta, right? And if there's compression of the aorta or the arc of the aorta, you're going to have blood or ischemia, right, to the head and the neck, right? And that will be very bad. So you have to understand that. And also because of this complication, this limitation, right? If there is infection can spread rapidly in the mediastinum, right? Infection, even inflammation, that is called media, uh, media, media tinnitus, right? That will be inflammation of your mediastinum, right? And then another thing that you have to take note of, that the cancer of the mediastinum, it spreads rapidly. It spreads rapidly, right? Because of the connective tissue that will be surrounding all of these um, viscera, right? So that's everything about the superior mediastinum and inferior mediastinum. Thank you so much and take care.